In Archish Fertility Center, you've named it as Bangalore's kindest fertility. What do you mean by that?
So, by kindest, we mean we are non judgmental.
I also believe that the fertility treatments are very expensive. Are they really very expensive?
The market is also very spoiled and it's got a very bad name.
So, what do cases like endometriosis, PCOD, PCOS, thyroid issues, how do they cope up with IVF treatment?
So see, PCOS actually, there's a very big myth.
Hello, Pritika here, founder of Fit Mom Club. And today's episode of Start Your Joy, we have our special guests, Rishina and Naveen, founders of Archish Fertility Center. Hi, Rishina. Hi, Naveen. Rishina and Naveen are embryologists themselves, and they happen to be IVF parents. So let's get started. All things IVF. So, Rishina and Naveen, welcome to this special show. And I know that we are going to be discussing something very, very important, except about the clinical knowledge. It's also your personal experience with the IVF treatments. So, when did you know that you needed help with conceiving?
So actually, Pritika, this we have to go back a little, but basically, I think we were trying for a couple of years, two to be precise.
Yes.
And because, of course, we were in this field, we had tested ourselves before we start the journey. And after 2 years, we realized that it's not working out. So we knew that we needed help. And that's when we realized. So we went with the IUIs. And then when that didn't work, we thought that if we ourselves, don't end up doing what we advocate, we seeked help. And then, yes, we underwent IVF. And now we are parents to a beautiful baby boy.
But would you be comfortable telling me exactly what the issue was with the.
Yeah, sure. So there was actually, there was unexplained
Ha,
infertility.
okay.
That's the reason when we did our test, when it came normal, we continued trying
That's
naturally.
good. That's good.
Yeah, because if it didn't,
Mm.
if it was not basically that test indicated something, we would have definitely jumped into IVF much earlier. But because it said, and we were working closely with the doctors because of her profession, the doctor said that, hey, everything looks fine, you're ovulating, your egg count is good, your AMH is good, his sperm analysis was good, so then they didn't see any issue. And that's the reason we tried naturally. But I was 33, 34, so of course I didn't want to waste a lot of time. So that's when we decided that, okay, let's not try more. There were doctors who were suggesting try another 1 year. We said no, and we jumped into the IVF
I
bandwagon.
think there are many cases with unexplained infertility, you know, like when both the parents are normal, I mean, all their things are normal.
Parameters are
Yeah,
Correct.
normal, yeah.
parameters
So,
are normal.
stats generally suggest about, say, good 25 to 30% even today will be unexplained
Yeah,
infertility.
true, true, true,
So,
true.
no matter, your, like she rightly said, the AMH is fine, you're ovulating timely, your periodic cycle is accurate, my sperm parameters
We're
were
good.
as per the WHO
Yeah.
standards, then it still takes a while.
So, Rishina, what were the hard days for you like? And, you might be thinking it could be because of you or it could be because of Naveen. And definitely the first one would have been like you would have felt it's because of me.
So honestly, as a personality, I didn't think it was me or him.
Okay. Okay.
I
That's
don't
good.
think,
That's good.
yeah,
Because most women, when they don't conceive, they think it's because of
right.
them. And,
In this case, it
and,
was the other way around.
He,
okay.
but maybe secretly, but
Okay.
I think as a couple, one great thing was there was no blame game. I think
Yeah.
that
Okay.
we were very, very
Yes.
clear about. We just knew that I need his sperm, he needs my egg, right?
That's good.
We need
That's
to
good.
complete the puzzle. So there was luckily, no blame game. And after we had a baby, that's when he said that he'll talk about it, that, he felt guilty that, maybe it's him. Yeah.
Hmm.
But to answer the toughest day, I think hands down was when I used to see a negative test, like month on month. Like if I say 2 years, that's 24 negative tests, right?
Oh, God. That's
So,
a lot.
yeah. So seeing that, and even after the IUI, I think that was the toughest part.
True, true.
That you're hoping, you're peeing,
Yeah, I
and
know, I
and
know.
yeah, and you're peeing on 100 sticks,
But
hoping.
good that y'all have been very supportive to each other in this journey and not blaming either.
No, definitely. But why I told this to her later is because we didn't want to have any external environmental stress or pressure on each of us.
Yeah.
But definitely, why I'll tell you a small, you know, example in this is she has been tracking her ovulation much before even we got married. So
Uh-huh.
we knew each other before marriage for about 2 years.
And y'all are experts in this, so y'all will
Yeah,
Yes.
definitely, test things on yourself as well,
correct.
right?
So we did that. And when she is so particular about things, and I was like a happy go lucky guy, never bothered about anything.
Yeah.
So then I felt like,
Okay.
did I not check everything on time?
That's
Is it because of me?
So how did you feel when you saw your test positive?
Of course. I mean, so I was I was actually after my embryo transfer secretly testing from the sixth day.
Okay.
And the biggest advice we as specialists give is please don't test early. But I don't think I listened to that. And I
I
was
could
te-
see a bunch of blinkage going behind
yeah.
my back
Ah.
always, because I'll be watching something, and secretly she'll come in quickly, pick up the brown, say, envelope. There were, I think, paper envelopes that time. She would
Okay.
take it quickly, go inside the room.
Mm.
Yeah, so I was testing. So I knew it's there, but I wasn't ready to share it with him yet, even if he knew, because having, like I said, tested so many times, a line comes later, it's a false positive. I didn't want to fall into all of that.
Got
But
it.
of
Got
course, there
it.
was a lot of excitement, but a
Got it.
lot of apprehension also, because again, like your mind wanders, right? So you're like, okay, it's come positive, but nothing should go wrong, nothing should happen. But definitely, I think excitement, but controlled excitement.
Yeah,
Yeah, I think that was the thing.
we had reached that stage.
Yeah.
Okay. So, you are both of y'all are embryologists, and there are doctors as well.
Right.
So, what's the difference between a doctor and an embryologist?
So it's like a coin.
Okay.
The head is also important. The tails part of it is also
Huh.
Yeah.
important.
Hmm.
But we share a 50-50%.
So you know the
Uh,
back end and the doctor is the
yes,
front end, like
yes,
that?
Yes.
yes. So every time across society, across the world, the first person whom a couple comes and meets to scan themselves to understand their history is a doctor. And once they're ready for any form of fertility treatment, not just IVF, IUI, timed intercourse, anything that has to be done with them, which involves their eggs and, say, sperms as gametes, the processing, the pairing of the egg and the sperm, selecting which embryo is better, giving our inputs in certain cases where embryos need further genetic testing, any advanced techniques have to be advised for sperms, any egg quality aspects that we come across when we are injecting the sperm into the egg, all those information, key informations come from the embryology side,
Okay.
and maintaining the hygiene parameters of the laboratory, because if there is no standardization and no hygiene in the laboratory, you won't get a good outcome with regards to your
Thank you.
embryos to be
Got it.
transferred back.
Got. And what are the red flags couples have to note before going to a clinic, a fertility clinic?
Yeah, so see, in terms of red flags, I'll say some, and I think some will come to Naveen's mind also. For me, if you ask me, like, of course, doctor is extremely important, but also check the credentials of your embryologist. I get it that, they wouldn't know the credentials, but at least they can ask, right? That, well, is there an full-time
Yeah, yeah, yeah,
embryologist?
yeah.
That then there are things like transparency in terms of even finances. That's a very big red flag. So
How much
how
will it
much?
cost?
So, like, example, like here we write it down and we give it, and
Okay.
then we don't budge from the estimate
Yeah.
that is provided.
Yeah.
So a lot of clinics, they will just say that ठीक है 2 लाख में हो जाएगा, but then as soon as you give your eggs or you have signed up for the process, it keeps adding up,
Yeah, yeah. True,
right?
true.
So that's a very big
I think you should be more transparent about the
yeah,
total cost of an
in
IVF
the first
treatment
visit.
so
Absolutely.
that the couples are more informed
Correct.
about it,
Yeah.
no?
And also, I feel the premises matters a lot. That also is a red flag. Now,
Yeah.
imagine going to a shady clinic where, it's a very
You're right, you're right.
private thing. So if
Yeah.
they're making you, because you have to visit multiple times. It's not a
You're
one-time
right.
visit.
Yeah.
So, if it's shady, that also should be a red flag wherein, you don't feel comfortable.
Comfortable. Yeah.
So I think those, according to me.
And also, if your questions are not addressed,
Mm,
be it whatever questions,
Mm.
your question should always be answered. No question is a stupid question, because how you rightly just now suggested that people wouldn't know, so there are a plethora of questions which they
Yeah, yeah,
don't
you
know.
should be, that hospitality should be there.
Yes,
They should be open to answering any question for that matter because that's why they are there.
correct.
Yes, absolutely. So that aspect, plus the hygiene factors which
True, true,
she
true.
mentioned, and always check the credentials of the entire clinic. Like how if the clinic is newly opened, obviously the credentials of the doctor is important. The credential of the team is important. So visit the website, see how where they've been working, so you know that they carry that much amount of expertise with them, right? That doesn't mean like someone decides to start a new clinic, the clinic will not work. They must have worked before.
Yeah.
So find about the expertise,
And
and
also
whether
report. I feel not giving patients report. You also must have encountered when you're, speaking to clients or whatever, that they would have done an IVF, they would have done all that, but there is no report of how many eggs retrieved, what kind of injection. So those are
Yeah.
big red flags that the clinic that we're talking about needs to give them a printed report, because it's ultimately their gametes.
Yeah.
And I know people might not know, but this is one of the questions that they can ask.
No, actually, they should be more informed before they go for a fertility treatment, I
yes.
Yeah.
would say.
So these are just things that they can do like a tick mark in their head.
Yeah.
And whether that clinic is doing a blastocyst day 5 transfer or a day 3, that according to me is the biggest red flag.
Okay.
Uh,
What's
because
that?
because day 5 or a blastocyst transfer is the highest or maximum days you can keep an embryo in the lab,
Okay.
and that
Okay.
gives you the highest success rates when compared to day 3 embryos.
Okay.
So this itself will answer a lot of things, because if the clinic is hesitant to
Hmm.
take your embryos to day 5, their lab health is not great.
Ha, got it.
So
Got it. That's a
this
good.
yeah, so
Yes.
these questions are very important for you to choose between clinic A, B or C,
That's
right?
good. That's
So
good.
these are some of the things, tips, or like things that you can find out.
Yeah. Yeah. So, anybody walking into a fertility treatment, any couple for that matter, do they all have to go through an IVF treatment?
Not at
No,
all.
not at all.
Not at all.
We've had couples who we have ourselves told, who have come informed from other clinics saying that you have to go for IVF. We have made them work up on their bodies, and they have conceived through natural
That's
conception.
good. That's good.
There have been cases which have gone to IUI, and certain, yes, there are cases which need definite IVF. Means
Yeah.
depends
Okay.
what journey or what stage they come at.
Yeah. So, I understand this side of it. But coming to the business side of it, honestly
Yeah.
asking,
Yeah.
won't you push a couple to a fertility treatment?
So I have a very fascinating thing for this. Um, if you generally see everything is a byproduct of what good service you provide. Today, if you are a doctor, I come and visit you. To just say hello, how are you? You're going to charge me a consultation fee, right? So the fee is a given, right?
You're right. Yeah.
So business will follow. If you give them the right method, there might be four other couples who are also seeking at the same stage where you are at. You might just refer them to us. So by there are no shortcuts in this, right? So
I
if you
hope,
do,
I
yes.
hope, I'm just checking the
No, no, of
genuinity
course.
of a clinic.
No, definitely, that's why means IVF is not the only road, or is not the only outcome, or the only suggestion that should always be given. So that's what we are trying to you know not eradicate, but kind of clarify a bit more, to say that don't get worried the moment you read a board on the banner saying that, for example, for Archish Fertility and IVF. Yes, IVF is our expertise, but apart from IVF, it says Archish Fertility. Fertility is a very broad spectrum,
Yeah.
and we can cater right from
True, true, true,
PCOS
true.
to you know anything in
That
that matter.
that's good to
Yeah.
know. Yeah. And see, for couples just hearing that they have to go through the fertility treatment and they feel overwhelmed about it, how do you walk them through?
So, see, honestly, I feel the trick to this is just counseling and talking. I think the overwhelmness or the anxiety comes because their questions are not answered, and that's true, right? Like even when having worked for 15 years for other brands, I'm not saying all did that, but there are doctors, or even in not just fertility, even if you go to a gastro and you have like a question and he says in 2 minutes he just shoves away your questions, you will get
Yeah,
overwhelmed.
yeah, yeah.
But imagine where you ask 10 questions and all your questions are answered or over answered, more information. I think the key lies there. I think a couple, at least what we've seen or we try, we've not seen a very overwhelmed couple, because whatever questions, and see, the questions might be very silly also, like he said, but for us it's not a question which cannot be asked. So I think that's where the whole difference is. We answer all questions, we answer them very normally, and we don't shun it away, right? Like, we don't say, oh, that's a stupid question. I think that is what the differentiator is.
And certain times there are limitations to the answers as well, because even as per science, there are only, example, in certain aspects, 3 4 parameters that are evident. Beyond that, internally also body works differently, so
Yeah.
each body is different, like it's a lock and key.
Yeah.
So certain things also rely on that. So it's okay to also say that these are the reasons, example, and the fifth reason we don't know, we'll
Got
have to
it.
find out.
That's good. Good to know. Actually, when you don't answer their questions is when they not answer, when they don't feel informed about what they're going to go through.
Yeah,
That's when
correct. Or
more
they don't feel
anxiety.
comfortable, right?
Yeah,
So
yeah,
of
yeah.
course, so they leave the doctor's cabin thinking, "Oh, I don't know about this. What is going to happen?" But imagine a couple who's like, "Oh, okay, it's going to be 10 days of this or 2 days of that." That makes a difference.
So who needs an IVF?
Yeah, so there are certain indicators which absolutely need IVF, and if they are told otherwise, that's wrong. So basically, like blocked tubes,
Okay.
or extremely low AMH. These are some, or extreme, like azoospermia is no sperm in the ejaculate,
Hmm.
or very very low sperm, which is known as
Hmm.
oligoasthenoteratozoospermia.
Hmm. Hmm.
These are some very strong indicators where IVF is the only option.
But it can't be worked out naturally even after, like, say, 3 months of lifestyle and dietary
See,
changes.
not for this, because block tubes,
Okay,
this,
yeah, block
right?
tubes, yeah.
AMH, why? Because, see, again, it's a very nice question actually, but you have to understand the balance, or the thing versus time versus quality of egg you're improving.
Yeah.
So maybe, so we never say zero, but say
Huh.
you take 10 low AMH couples,
Hmm.
maybe two will get pregnant naturally, and that's a very big win.
Hmm.
What about the eight? So I'm talking about law of averages,
Okay, so
where
maybe they can go through a 3 to 6 months period of, trying naturally after making the lifestyle and dietary changes, and then they still don't conceive, then they can move for an
But
IVF
then you think
treatment.
about it. If a girl with AMH of 0.2,
Okay.
okay, very low AMH,
Hmm.
she's put on 6 months of lifestyle changes. Her AMH in 6 months is almost going to drop to zero. So, in the attempt to, yes, increase her quality of
Quality.
eggs,
Okay.
we are
Okay.
losing out on the reserve.
Okay.
So dietary changes can work on quality. They cannot work on quantity.
Yeah, yeah, that I know.
Yeah. So
Because once you cross 35, then the
yeah,
number of eggs go
correct.
down. And at that time, we cannot work on the number. We can only work on the
Quality,
quality. And
correct.
again, you say uh, if it's again going to be going down with the number of years, we don't have enough time to
Yeah.
work on the quality.
So the ideal situation, we are all up for nutrition. We don't even feel IVF should be a first, approach.
Yeah,
But the right way to do it in low AMH cases is go hand in hand.
that's
Mhm.
Do
good.
your nutrition so your outcome for IVF improves,
Improves.
but
Yeah.
don't put IVF on hold, because we don't want you to reach a scenario where your count drops. And once the decline starts, 6 months is a very big time for the decline to happen
Okay.
completely. That's
Okay.
the difference.
Got it. That's a good point. In India, no, there's still a stigma about IVF. People do not openly talk about it. Why is it? Okay, I cannot ask why is it,
Yeah, why
but
also you can ask.
okay, then
Yeah.
why is
I
it?
think majority it's because there is still, like, how much ever we get evolved or urban crowd. I think even in our own house, to be
True,
honest,
true, true.
there are some senior citizens who felt IVF kiya to it's not your child. I think that's the reason people hide it
Yeah.
the most.
That
India.
and
Yeah.
yeah, and
India.
no, no,
Yeah.
it's true. And one thing that I keep telling so many of them is like, IVF doesn't mean issues with intimacy.
Yeah,
It's a
correct.
different
True,
story,
That's
no?
also a
True,
right?
very
true,
big.
true.
Like I can have the best intimacy possible, but if my sperm is not at the level where what is required to have a natural conception, I need to work on that.
Yeah,
That's
yeah,
not
yeah.
changing this side of the story,
True,
Correct.
true,
right?
true, true.
Yeah, I think it's that. It's one, they feel it's not genetically your child. Second is they feel, there's some issue with intimacy, or if, for men, I think they feel it's questioning their
Yeah,
manhood or something. So
absolutely.
I think these are the reasons why people don't talk about it very openly.
Hmm. So, what do you have to say about male and infertility?
That.
When it comes to male infertility, ideally today's scenario, almost 50 or more than 50%, not almost 50 definite, but more than 50% of the cases have male parameter contribution for being a cause for infertility. So means they come into the IVF clinic. Why? Because the male parameters are not up to the mark.
True. Okay.
So WHO, the World Health Organization, it every time measures and declares a standardized parameter check to suggest that whether your sperms are normal or not normal, and that's what we refer. Uh, we must be doing probably hundreds of semen analysis every 2 days every week. We hardly see normal semen coming um, you know 5 to 10% of the times.
Okay.
Otherwise one parameter or the other is always compromised. So male is a very big factor that we need to look at, and I feel it is very less studied as well and very less advocated as well.
True. True. True.
A
True.
very nice story is when we started Archish, when she mentioned before about a case of azoospermia, wherein there is no sperm at all.
Sperm. Mm-hmm.
So there is ejaculate, which is the semen. I mean, the liquid comes out, but there are no sperms inside
Got it. Got it.
the ejaculate. So this gentleman, he came with his wife, and he came for a semen analysis, and we found out that there is no sperm in it. We addressed that issue because we want to give out the truth.
Mm-hmm.
Um, he didn't believe it. He went around for the next 6 months testing his sample in 10 different laboratories,
And his
came back
answers.
seventh month and did treatment with us because we were the first to tell him that you do not have. But he
Okay, when
couldn't
you
believe
don't
it.
have sperm in your semen, can you make it?
It depends if it's hormonal or it's a blocked tissue. If it's a there can be no sperm in the ejaculate for two reasons. One is your tubes are blocked, so the sperm is not coming out, and the other is there's a hormonal issue. Blocked tubes you can treat with things like TISA, where you take the sperm directly from the
Surgically out.
testis. Yeah,
Yes.
But
surgically.
then what do you do in such cases? So,
Nothing. So either TISA is this. If it's hormonal, you can't do anything about.
what is TISA?
TISA is where you take the sperm directly from the testis because it's
Okay.
not
So it's a
coming out,
surgical extraction of the sperm.
Okay.
because the sperm
So
is
that
not coming.
happens in what did you say? Us. I'm missing.
Azoospermia. So,
Okay.
but when the tubes are blocked,
Huh.
but if say the person is not producing sperms only, it's a hormonal, like a factory issue, example,
Yeah, yeah, yeah.
then you can't do anything.
Then you will tell them that it's somebody else's
No, then they
sperm.
have to consent for it, and the
You
treatment
do
can,
you have some
of course,
form
of
of
Absolutely.
course, we
Um,
can't just.
Hands down.
Yeah,
It's
true.
a life birth that you're getting into the world. So the family should know
You're
whom
right, you're
they're
right.
getting into the world, right? So
So how positively do they take such
again, it's the entire aspect about how you counsel. If you tell them the right way, give them enough time, not pressurize them, and tell them the right way, give them a month to again work on their body, come back again, test it, so they understand.
but
So
do you
it's a
think,
gradual approach.
such things causes disagreement between the husband and wife?
In few cases, yes.
But you would have seen it in like
Not
real, no?
really, to be honest. I feel when you break such a news where, say, either the egg reserve is not there or the sperm, I have not seen couples go at each other or fight.
But
They,
I think Bangalore is more, progressive also, right?
yeah, maybe. But I think they do it outside the doctor's cabin,
Yeah,
to be
means it
honest.
does not come at the
Yeah.
face.
Yeah,
True, true,
So
true.
maybe they would just shy away from the treatment, or maybe they would say that this clinic is not good.
yeah.
So we'll go to another clinic.
But I think few couples they might go for one or two other fertility clinics
Yeah,
to
yeah,
Yeah,
they'll always do a second
get a
opinion.
confirmation.
Yeah.
I
and
think,
which
and
they
that's not
should.
that's not a wrong thing.
Not at
No,
all.
not at all.
Not at all.
Yeah.
And especially when we are in a stage where there are so many fertility clinics
Huh,
available,
I know.
they should access.
Yeah.
Right.
So what do you say to improve male fertility? What do you do? Like,
So, firstly, lifestyle changes broadly. Under lifestyle changes, the predominant ones are to reduce smoking and drinking, because it's unfair to just generally say a person who's smoking 10 cigarettes to just quit, right? So, gradually reduce it.
reduce.
Same with regards to drinking, smoking being a bigger devil. Drinking comes in priority three, and the third biggest devil, which is now coming up, is vaping. So all those three need to be reduced and controlled. Apart from that, you need to become a little bit more active, and rest of the things are same for a male and a female with regards to eating right, avoid processed food, right? So rest all
True,
remains the
true,
same.
I mean, add in more antioxidants, I feel. And, we've all been led to believe that blueberry is the only,
true.
great source. But I think if you look locally, things like guava,
Yeah,
nuts, any
yeah.
green leafy vegetable, these things, if you include that in your dietary thing for especially for men for 3 months, I think there will be a change. I mean, it'll get better. It can't get worse. So worth a
Yeah,
shot.
So, does age play an important role in fertility? For women, yes. Okay, for women.
absolutely.
So, yes, age does play a role. And here I also want to bring out a very important aspect that, say, a woman who's 35 in India and someone like, we look to our European friends or American friends and they're like, hey, they conceive at 40 very naturally. So, age doesn't matter for me, right? So, basically, we had done a study wherein it says that Indian ovaries, Indian women, they age 6 years before their Caucasian counterparts. So
Okay.
that's the reason why your Caucasian European friends are able to deliver babies without IVF at 40, but you may struggle at a 34 or a 35 because that's the,
Okay.
yeah, average age for Indian genetics.
So, I got pregnant when I was 22,
Oh.
Wow.
and it was a very quick
Yeah, I'm
pregnancy.
sure. Very
Like,
smooth, yeah.
super quick.
Yeah.
I got married for 1 month after my marriage, I was pregnant.
Pregnant.
But because that was also a lack of knowledge about getting pregnant, that I had a quick, I did not know about planning pregnancy, and, I didn't even know what it was too. So it was a very quick pregnancy, but I could see that difference that, age really matters.
It does, definitely.
Even like if I talk about myself, I conceived at 35. My AMH was great. My AMH was 2.3, 2.4, which is a very good AMH, and that's why when the doctors advise there's nothing wrong.
Huh, huh.
But maybe the quality, I don't know, right? So,
True, true, true.
and this I would say, being a healthy individual, I don't smoke, I don't drink.
Yeah.
So the message to women is that they should not beat themselves up. Don't feel that, oh, you're fat, you're thin. If that was the case, athletes would not
Yeah,
need
yeah,
IVF.
yeah.
Here we know of a NASA scientist who's needing IVF. She
Yeah,
may
yeah,
be
yeah.
in the best of health, right? So there is nothing like that. It's like graying of hair. It may happen soon for some, later for others, and there is no reason, and it cannot be reversed. That's a very big message that I want to give, that you cannot reverse your AMH. Maybe,
That's for sure, I
yeah,
know.
you cannot reverse it. Quality you can still do, but how much? But don't race against time. Like, to improve
Yeah,
quality,
yeah, yeah, yeah.
don't
You're
wait six
right. You're
months.
right.
So,
So for male, again, is age important when it comes to fertility?
Yes, definitely. Age is important for, say,
Men as well?
male as well. Definitely. See, what happens is because um, there is no proven science yet to say that uh, the sperm will deteriorate over a period of time as compared to how it's for the women. But your age is increasing, your lifestyle is taking a change, your stress is taking a change.
True, true,
All
true.
these environmental factors have an impact. So it is
On the
wrong to
sperm
on the
quality.
sperm quality.
Yeah.
but
Definitely
not count. Yeah.
not count,
Not count.
not count. But that's where it is taken for granted. And that taken for granted is in the aspect saying that everything is fine with me.
True,
It's
true,
not.
true, true, true.
Because that puts a hidden pressure on your counterpart, right? So that's why it is important not to take it lightly, right? Because I can just say, yes, I have that advantage of so many years and my count is not going to go down. Yes, but your quality is going down. So you can't just take it lightly, right? You do your part.
So do you think diet and fitness have a huge role to play when you're going through an IVF treatment?
I honestly do not stress them out. I don't say, hey, come back to me with losing 10 kgs. That is not what we want to do.
True.
In terms of nutrition, what we tell them is, please cut
Eat
out, yeah,
healthy and
eat healthy, Go back to what your mom used to say or your grandmother used to say, eat home food. Also because you don't want to catch other ailments like, stomach infection, all of that during your process. Eat healthy, get your fibers, get your protein, eat a balanced meal. That is what we recommend.
Okay.
We don't ask you to eliminate a lot of food. Eat what you have been eating as a kid. So now if someone in South India has been eating ragi, I can't tell them stop ragi.
True, true, true.
Whereas someone in North India, if they're born on parathas and butter, you can't just say just stop eating parathas.
Yeah.
So you have to be very reasonable with what advice you give the patients, because ultimately you are the only people they are going to listen to and stress about.
True.
So, A, nutrition, do as much as possible to the root. Second, in terms of exercise, we say get movement in. So, try
Yeah.
getting 10,000 steps, do Pilates, do yoga. Please don't go on a weight training or buy a gym membership just because you're an IVF, because your body has not been used to it.
Yeah.
So, suddenly
No,
don't.
no, not during the IVF treatment, before the IVF treatment.
Before also, like, don't do rigorous
Yeah, yeah, yeah.
exercise,
True, true,
but
true.
yes, get some movement, walk, Pilates, yoga. These are the best forms, because this is something you can continue during and even after you're pregnant. So something which is sustainable.
Sustainable.
Yeah.
That's good.
In moderation, and clean your system a
Yeah,
bit.
yeah,
So
yeah, yeah.
those are
Fair
very
enough.
important.
Yeah.
Fair enough. Because again, see, after getting into the IVF treatment and then it becomes successful and then you have diabetes,
Yeah.
Absolutely.
right?
Yeah, yeah.
What's the
Yeah.
use
Correct,
of
correct.
going through so much process and then your
Yeah.
health doesn't support?
Yeah, correct, correct. So no, you have to be mindful, because also think of some like a plan which is sustainable throughout your pregnancy.
Huh.
Because like you're rightly saying, it has to be a healthy pregnancy also.
It has to be.
Yeah.
So we keep telling them, even if it's IVF treatment, please hear us loud.
Yeah.
Oh,
Your health has
absolutely.
to be at
Of
optimal level.
course, of
No, no,
course.
definitely. Thank you for passing that message, but it's so very important.
Yeah.
Really.
Don't think, yeah, I don't have to do anything about my health. I can go for an IVF treatment.
No,
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 it
no,
doesn't
No, no.
work that way.
no,
Your
no.
IVF treatment will not support if you do not have your foundation strong.
Correct, correct. And
And
not
getting,
just
yeah,
IVF in general, right? Like, because now today you're pregnant, you're 6 months pregnant.
Yeah,
If
yeah.
your back is hurting, example, I'm saying,
Yeah, yeah,
or,
yeah.
you have aches and pains because you've not been, living a healthy lifestyle, what's the point?
No, there's less awareness about that.
Yeah.
They think, going for an IVF treatment
Means
is
everything is okay.
everything is
that's
over.
what, getting pregnant is not the only goal. Like,
Huh.
it's just the start,
Yeah, you need to have a
right?
healthy pregnancy.
Definitely.
So, what do cases like endometriosis, PCOD, PCOS, thyroid issues, how do they cope up with IVF treatment?
So see, PCOS actually, there's a very big myth, Pritika, that where they say that PCOS women, have a lot of eggs, right?
Okay.
PCOS women will always have a lot of eggs, but their egg quality will be a little
Got
lower,
it, got
right?
it.
So they feel that because I have so many eggs, I don't need to go for IVF.
Mm,
But in fact, women with PCOS are the best candidates for IVF,
okay,
because they make a lot of embryos. They don't need a lot of injections.
got it.
And if like my actually message to them is, if they've been struggling for a while, don't go for those repeated ovulations. It just taxes your mind. Just go for IVF. Get it done with. Freeze your embryos, freeze your sibling embryos, and then you can get back to your lifestyle. So PCOS, I feel, is easier to manage with. Endometriosis is
Yeah,
slightly trickier.
yeah.
So it depends, where
It's
the
great as well.
yeah, on the grade, and whether it has already impacted your quality
Quality.
of eggs or no. But of
Mm.
course there's a way around,
Mm.
and I would, to those women, suggest that don't waste time, because yes, nutrition can help, but it will not reverse the damage which endometriosis is doing, right?
Doing. Okay.
So that is it. Thyroid and the other things you mentioned are fairly simpler to
Simpler.
manage.
Yeah,
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 it's
yeah.
not that bad.
Yeah. I think with lifestyle changes,
Yeah,
it
it
can be
can.
Yes.
under
Yeah, it can
control.
be. Yeah,
Yes.
it can be managed. So,
Okay.
I mean, and exactly like how you are also an expert, it depends on the values of TSH, thyroid,
True,
how
true.
bad it is. So, if it's borderline, please go with the nutrition way. You
Yeah,
don't need to
yeah,
take meds.
yeah.
So, depends, but those are fairly easier problems to deal with.
What is uterine lining?
So, uterine lining is the cushioning of the uterus,
Okay.
that is called endometrium or the uterine lining.
Mm.
So why it's important is IVF is in two parts. Okay,
Okay.
the first part you're working on the eggs, you're
Yeah.
making the eggs, the embryos, all of
Yeah.
that.
Yeah.
You ignore the uterus completely.
Yeah.
The second part, when you have to place the embryo back into the
There.
uterus, you need to work on the cushioning of the uterus, which is the
Okay.
uterine lining.
Okay.
So when you go in for a transfer, there are scans where you check how thick is the uterine lining. So there are multiple factors: the thickness of the uterine lining, the flow, blood flow in the uterine lining, and all those aspects. These are responsible for a positive pregnancy. So that's why it's critical that at that time you're taking a little more care of yourself in the same way that I suggested,
Mm.
because now you're working on your uterine health or your
Yeah.
endometrium.
Yeah.
So that is
Okay.
also one reason for couples to understand that
Mm.
majority of the clinics today do your IVF in two parts.
Yeah.
Mm.
They will do a frozen embryo transfer. So the
Okay.
first part will only be egg retrieval.
Mm.
So stimulation of your eggs, then fusing the eggs and the sperm together
Mm.
and growing embryos and freezing them,
Mm.
or probably doing the genetic testing and keeping it ready.
Mm.
And the second part would be to work on the
Yeah.
Uterine
endometrium,
lining.
on the lining in the next month or the subsequent month after that, and then transferring the embryo.
So, coming to the egg quality of a woman, which nutrients matter the most for the egg quality of a woman?
So the nutrients that matter is antioxidants, CoQ, and these are given through your journey. So as specialists and as doctors, who are there in the fertility space, they will try and maximize in terms of with medicines, right? But like I was mentioning earlier, like if you're able to get your antioxidants from blueberry, guava, please do. If you're able to get your vitamin C from nimbu pani, please do that. But otherwise, this is the holy grail. CoQ, antioxidants, folic acid. So these are some of the known nutrients which are said to improve the egg quality. When you talk about South Asian women or Indian women, it's not about quality. We don't know about quality, and quality for everyone will be different. When I was mentioning that, I was just talking about the ovarian health,
Got it.
age
Got it.
rather. So say an AMH of, if we see Indian women at 35 having an average AMH of say a 1.5, hypothetically, that same AMH will be seen in Caucasian women at 42. So the
Huh.
chances of natural conception are easier.
Easier.
That's the difference. But we can't really tell the quality one from the other.
Because I've got a live example, and we keep joking about it in house. My cousin's wife, she's an American, she's a white
Mm.
American. She conceived at 40 and 42. So in my
Naturally, yeah.
naturally, and in my house, it was a saying that, oh, she conceived so nicely. Yes, that's the difference that we're talking about.
Yeah.
So even we being inside,
True, true, true.
sometimes at home, our word is not taken very
Yeah, yeah,
appropriate. It's
yeah,
like,
yeah, yeah.
ah, he'll say whatever. We'll check with the
Mm.
doctor for that.
Yeah,
IVF treatment, more than it being a physical journey, it's more of an emotional one too.
absolutely.
Absolutely, it is. It is.
Yeah. How do you manage your clients?
So, in house, like the same way, there's a lot of counseling done by the doctors, by the team. But recently, we've also tied up with like a mental health partner.
Ha.
It's called Amaha Mental Health.
Yeah.
And because we feel that couples who need a vent to speak a little more, and there are a
Yeah.
lot of crises
Yeah.
going on, pressure from family and all of
True.
that. So, which we feel our team will not be able to handle. We seek their help, and we've partnered with them to give them like an outlet where they can talk about their feelings, and maybe that will help them through their journey. That's what we've done.
Did y'all go through that emotional meltdown during
In
your
s-
IVF treatment?
Oh.
in
Though
some
y'all.
bits and pieces we did. Say
Hmm.
in some bits and pieces, like the thoughts did come. Like like I said previously also, is it because of me? Why is this happening? Like we practice this day in day out. So why is it happening? We're all informed. So it does come, but then yeah, then the science comes in, and
Hmm.
then you kind of say
Yeah.
no, it's possible. So
I
Yeah.
but
don't
it did,
think we did,
did.
if you hear my side of the story, because I felt we had a very good support system.
True, true, true.
I feel, suggestion to couples is have a very good support system. Have
Hmm.
one person you can really talk to.
Yeah.
It can be your spouse, it can
You're
be a
right.
friend.
You need to have a
Anyone,
good
But
yes.
have
support system.
one
Yeah.
person to, whom you can speak to about your minutest or your biggest fears, I think that will really ease it out.
Is it
Like for
out?
me, I should just dump it on him, but whoever it is for that person.
Okay. In Archish Fertility Center, you've named it as Bangalore's kindest fertility. What do you mean by that?
It also stemmed from the fact that, of course, as working embryologists, we meet couples. We used to meet couples day in and day out. But I think personally, when I went through our IVF thing, we realized that because we did it at Archish, it was really comfortable.
True.
But we didn't see that with a lot of couples, right? Like outside when we used to work just as embryologists. And that's where the thought stemmed that being kind to
It's
anyone
yeah, yeah,
walking
yeah.
in,
It really
simple, yeah,
matters.
simple thing like just asking, are you okay? Really makes a difference because during the whole journey, I feel a lot of couples feel unheard. And that's where the idea stemmed that, okay, we are kind, we will try to see, everyone will have some problem or the other, but as far as possible, we'll be the kindest, non-judgmental clinic or people that the fertility couples have met.
Yeah, and pressure and thoughts come in different time
Ways,
points,
yeah.
different ways. So, I remember one of this story. It's a very simple one, but it hit us very hard. Is we were standing in the reception, we were planning something. There was a couple who walked in. The wife, where wanted to speak something to the doctor separately. So the husband wanted to go to the washroom. The husband went outside the clinic. So we were like, why are you going outside? Because he was going to the common area of the building somewhere. I said, we have made washrooms for you. He's like, in the previous clinic I went, there was no male washroom.
Uh, okay.
So
Okay.
we have had a couple who say that he used to not eat anything for the whole day when he used to go to his old clinic. Why? Because if he had to go to the to the washroom, he had to climb down the whole building, go to the neighboring building for the
Got
washroom.
it.
So so such a small twist also can have an impact.
Yeah, yeah,
We
yeah.
don't know in
Yeah,
what
yeah.
way it will
No,
come.
you'll dread coming to a fertility clinic. No,
No, even
like the experience. Oh,
yeah,
as such, the
thought, yeah,
no, as such, the process is already a huge process. In
right.
that, all these are more add-ons.
Yeah, yeah, absolutely.
No, even the thought, like previously, wherever we worked, we used to see that now collecting semen is a little awkward thing for any male, right? Like, so they go in and then they would have to walk through the entire reception to deposit the sample at the lab. And this is something literally we've changed with Archish. Like, if you visit, it's very, it's at, it's one of the corridors, the collection room, and the lab. It's
Yeah,
such a
yeah, yeah,
simple
yeah,
tweak,
yeah, yeah.
but that makes such a difference. And we've had, like, guys or men say that, thank God I don't have to walk, because they've deposited samples at other clinics. And
True.
so, we've just been mindful of these tiny, it's not major,
No, no, no.
honestly.
Like, I think,
Yeah, but
the
it's,
amount of importance we give to women, we should make the men also feel
yeah,
comfortable to
comfortable.
do
Yeah,
it, no?
correct.
So, what made you come up with the transparent wall lab?
It's just that we were very confident of what we do and we have nothing to hide. That's the only message that we wanted to put out by doing that. That as people working in the lab, we know what we do, we know the science in and out, and we have nothing to hide.
Yeah.
So even if and we don't just put on a website, or we have HEPA filters. You can see the HEPA filters.
Mm.
We don't just have a sterile lab, we do have a sterile lab, and you can see, because I kid you not, so many labs put that on the website, but it's
Mhm.
not.
Okay,
Yeah, means
okay.
we
Yeah,
just do. It's a usual day's work, right? There's a person who's an accountant. He's good at accounting. He's doing accounting. There is a team who's good at lab work. They're doing lab work.
Hmm.
So it's a everyday work which is happening. Why do I need to hide it away?
True,
that's
true,
So let
true,
that's
it be
true,
in the
true.
front.
that's just the thought. I mean, it was very simple.
So, coming to the IVF treatments, there are failures in the cycles. And how do you actually handle such failures?
So again, I think it's counseling and saying facts. We don't talk anything like, Bhagwan ki marzi nahi thi. And there are people who talk like
Oh,
that.
there
There
are
are
a lot.
there are a
There are a
lot of
lot of
doctors
clinics,
who,
doctors, embryologists who will say that
yeah,
the it's
time
big
sahi nahi
time,
tha,
huh?
time sahi nahi tha.
It is fate. It
Yeah,
is you. I mean, those are not the right answers they need. It's
yeah,
all about counseling and speaking
facts,
on data,
data.
right?
Yeah,
Yeah,
that makes more
Yes.
sense,
Yes.
right?
correct.
Like it'll be more convincing for the couples as well. other than just
Yes.
talking other things.
No,
Yes.
and also I feel keeping them informed at every step. Now, like we said with the transparent wall, right? Like if the egg quality is not good, we show them. Seeing is believing. So their expectations are also aligned. Then next step, like say we inform them how many are fertilized. Now, if the fertilization is low, we know there is something wrong with the gametes.
Mm-hmm.
So then if it fails, the patients also know that I was informed at each step. So
Okay.
so that is very very important, that keeping them informed at every step. If we do that, we've
Mm.
not really, even at Archish, faced any issue where the patient is lashing out. I was not told, nothing. I think it's all about counseling and keeping them
So,
informed.
when do you decide that after this many number of IVF treatment cycles, this is not going to be a
So
successful pregnancy or successful treatment?
So there is never a set number for it. It's
Okay.
always analysis of the entire cycle.
Okay.
So, like she mentioned before, we give them a guided tour of the entire work which is happening in the IVF laboratory. There are couples who come in saying that I've got 10 eggs, so
Okay.
I'll get 10 embryos.
Okay.
So we've got to first break it down saying that you've got 10 eggs, but we will maybe not inject all 10 because all 10 are not mature.
Okay.
So we will probably inject only about 8 of them.
Okay.
The next day, maybe 7 will fertilize. So it's like a old age grape chart, wherein you start with 6 grapes, then 5, 4, 3, 2, 1.
Okay.
So it is the survival of the, fittest, right?
Okay.
So it's that embryo that we will transfer. So the cycle gives a lot of information
Got
to
it.
tell them what their next steps will be there, plus the entire journey of embryo development from day 1 to day 5, at which time point the embryo started changing or didn't develop the way the embryo was supposed to develop, tells about the egg quality, tells about the sperm quality. So what answers we get from their cycle is what we address, and over a period of time we say we will keep working on it unless they say that, okay, I think my gametes are not working, do you think we should take donor eggs or donor sperms?
Mm.
So in that case we evaluate even that, but there is never a saying that you've done 4 IVF cycles, now you will not get pregnant.
Got it.
A
Got it.
classic example is what you gave yourself after eight,
Yeah. Yeah. Yeah.
years of
Correct.
trying natural conception,
Yeah.
right?
Yeah.
So
but
Right.
yeah, but to add to that, I also feel that yes, there is no set number.
Mm.
It also depends on how you've been doing the cycles, where
Got it.
you've been doing
And you also progress as cycles
cycles. Yeah,
fail, right?
correct.
Like you get
yes,
better with the cycle failing and
Mm.
provided you get the right information out
yeah,
of
right,
it.
right, right.
No, but I'll tell you of a case where we refused the cycle. So she came in early years of, beginning of Archish, and she had already done 2 cycles at a very famous center. We did the first cycle, and her embryos did not progress beyond day 3.
Okay.
There was so It's a quality issue. To be honest, we tried everything, ovarian PI, whatever medical science could
Mm,
give.
mm,
I hats off to the couple. They really were like, no, we will keep doing. I think they did 2 more cycles with us after ovarian PRP. Same outcome. Embryo was not reaching blast. If the embryo doesn't reach blast,
okay.
you're not going to get an outcome. Then they came back and we said we cannot do the cycle because now we know this is a hard stop. And you may take donor eggs, you may take donor sperm, but with your own gametes, it's not going to happen. They were disappointed, but that's an ethical call we took. It's easy for us. We could have just injected her, taken the money. But as specialists, we know it's not going to go anywhere. So that's
Yeah,
where
that's
you
good.
stop.
That's
So
good.
I think it's more than number, it's more an ethical, it's more a combined discussion with the
Got
couple.
it.
That's what matters.
What's the maximum number of cycles that you've seen and then seen a healthy pregnancy?
Not
Sorry,
5 continuous at Archish, but
sorry,
Yeah,
successful.
yeah, some,
cumulative a combined
yeah.
5 at Archish, we've seen 3, I think one.
But that is to pool.
Yeah,
No, so usually if everything is done well, by the second cycle you should
You
get
should
your
get.
pregnancy.
Huh, got it,
So we
got it.
haven't seen like very high, maybe 2, max 3, but that
yeah.
also is to pool the embryos,
Yeah.
not transfers.
So does stress affect the IVF treatment?
Largely, greatly, completely
Yeah,
is because,
true.
and large and more so on the say woman or the lady involved. The reason is because At the first part of the cycle, when both the couples are, changing lifestyles, improving their bodies to get the right gametes, once the embryos are created, the embryo has to be transferred back into her, right? So she has to be completely stress free. So
Hmm.
stress plays a role when it comes to after embryo transfer, because the worry that I might come negative, the worry that I have only one embryo left, the worry is the right time, should I wait for another cycle? So that stress plays a very big role.
So that's why even corporate women, whether egg freezing or for IVF, when they come, we advise to them that egg retrieval can be done anytime. Like you can adjust all of that. Embryo transfer, do it at a time when you have less pressure, less deadlines. So say someone in marketing, the Diwali to New Year to February is their peak season, right? So that time we said your embryos are frozen, please don't worry about it, but take it at a lean period, because that is the biggest marker whether it might come positive or negative, and that's not in any report. So that's why in terms of data, like when it's a negative cycle, when we talk data, I think what it means is that, like Naveen was saying, that not every egg is an embryo. Also that every step of the cycle there is attrition.
Can working women go for an IVF treatment?
Absolutely. In fact, we encourage that. Also, again, it's a very big myth that you need to come to the clinic every day to take injections. So, we are very strong advocates of you coming to the clinic as less as possible. So, the ideal IVF scenario is that you come in those 10 days only twice or thrice to the clinic for scan. You need not come to the clinic every day. Also, the remaining injections are packed and given to you.
Okay,
You store them at home. We teach you how to take the injection. They are like simple insulin shots. We don't use those old age
got it.
big needles, all of that. So you can very well take the shot at home, leave for work. So we want to integrate IVF within your working
Got it.
routine. It shouldn't be an additional stress. Similarly for ET also, your chances are minimized. I know of clinics who will call you every day for injection, every day for scan. That adds to the stress, and that's why IVF has such a bad name, that oh,
True,
it's so
true.
stressful. So not at all. So working women, please, you can take it and it fits right into your work schedule.
That's good.
And we are the biggest advocates for that. Like she rightly said,
Mm.
that we pack and we give the injections. The entire goal is to
Okay.
make this process as easy
Easy
as
as
possible,
possible. True.
not as cumbersome as possible, right?
A very interesting story of this single woman. She was 38, works in big one of the big fours, not in Bangalore, in America, in Seattle, in fact. She got to know of us through a friend,
Okay.
and her friend, I'm sure, recommended. And she said, if I have to freeze my eggs, I'm going to do it at Archish. So she was visiting her friend that time. So we did all her analysis, everything. We packed the injections. She carried it, to America, and of course it was over call. We had taught her how to take the
Okay.
injections.
Okay.
Day two of her period, she started the injections after a blood test. Day six, she decided to come to India because we need her only on the 10th day for retrieval, right? So she came around the sixth day. She worked through her India office in Bangalore. She used to come for scan. She used to take the injections at home. 10th day, we did the retrieval. We froze her eggs, and 2 days after that, she flew back.
Okay.
So she till today, like it's been 2 years,
So yes,
and
yes.
till today she's extremely happy. She feels I didn't take a leave. It wasn't stressful. It was so easy. So it's just about asking your clinic how you can do it more seamlessly.
Seamlessly. That's
But
good.
it's extremely, I mean, it's very, very possible.
And that also reduces, stress on us as entrepreneurs and people running a clinic. Is we don't run behind volumes, we run
Yeah.
behind this quality,
Yeah.
Yeah. No,
because
then
it's a
volumes will
testament.
follow. Then
Correct.
Yes.
volumes
Yeah.
follow, right?
So
I think only the extreme training may have an effect,
Correct.
but otherwise it's good
Yeah.
yeah,
regular
So
workouts
she
and
she froze her eggs with us. So yeah, very interesting
yeah, and
stories.
even after the retrieval, it's just a 2 day break that you have to take
yeah.
Only
maximum
two,
for,
one day.
no, for extreme, like for a
Ah,
sports personality to reduce the
mm.
training. But for a regular person who's not into sports and usual work, it's a single day break.
Single
Sing.
day. Next day you can resume work.
Yeah.
That's
So
good. Yeah. So there's this myth that the IVF treatment is for women 35 and above. So is age a factor for IVF treatment?
no, so AMH is not age.
Ah, correct.
So what we would suggest is as soon as you hit 29, how you get your annual blood test, get your AMH tested every year.
Okay,
Your friend at 32 might have a different AMH than you. So
got it.
it does not mean that at 32, if your AMH is good, your friend's AMH is good as well, or vice versa.
Okay,
So it's all about testing AMH. There's no other way of knowing.
okay,
Your periods may be regular, but your AMH could be low. That's also another myth. So, average age after 35, yes, it declines, but you can have low AMH even at 30. And we are seeing more women at a younger age having a lower AMH.
okay.
Yeah,
That's alarming.
that is
That is
alarming.
alarming, definitely.
I think lifestyle plays.
Lifestyle, puberty hits earlier,
Yeah,
a lot of genetic, factors.
everyone thinks, if it's twins, it's IVF treatment.
Mostly yes.
Mostly,
If
yes.
you see twins, it could be IVF, but whether IVF gives twins always, no,
No.
No,
it's that way.
okay. You take the best one.
Yeah.
Like, and even if they conceive and the probability of one child not doing well, at least the other one
No, so
survives. Or
no, it's
when you
basically
conceive itself, both the children will be doing well.
no, it's not about that. It's about when you put we put two embryos mostly in
Okay,
IVF.
okay.
So why twins? Because both can implant, one can implant, or zero can
Zero can
implant.
implant.
Oh,
That's why twins. So, but if you're very sure of your grading, you don't put two. You just put one embryo. So then there are chances of twins is very low.
And
That
from a
is.
couple point of view, it's like flipping a coin. If you transfer one, it's either going to come heads or tails, right? So it's
hmm.
going to come yes or no. If when you transfer two,
It's,
there is a slightly higher chance that maybe two might not implant, but one might.
but what if I want only what if I want only one child?
So
But
then we
Then
transfer only a single one.
no, but you say that I put two embryos and then out of that, if one is successful, it'll be good. What if you understand? You put one and that one is not successful.
but that can happen with two
Two
also, no?
also, right?
Okay,
So zero
okay,
can be in two also. We're just
okay.
increasing the
So what I
probability.
always thought was they always do it as two, so that if one doesn't go well, the other one.
No, no,
No,
no.
no,
It
no,
can be
no.
zero also, no?
So there are
Mm.
couples sometimes who come for secondary infertility.
So they okay. So then the couples might be thinking, why to go for an IVF treatment again? Might as if they're planning for two children, they just go for two embryos and have
Yeah, but
That
twins
also,
again.
but that's not the only reason,
mm,
right?
Hmm.
So because we've had, like I was saying, we've had people come for a secondary infertility. Secondary infertility is when you have your first child
Yeah,
through
yeah,
natural
yeah, yeah,
conception.
yeah, yeah, yeah.
Second, you need a fertility assistance.
Mm.
So in that case, when they already have one child, they are very conscious saying that we want only one more. We don't
Ha,
want two
yeah,
more.
true, true, true,
So
true.
in that case, we transfer only one.
Okay,
So that can come either
okay,
positive or negative,
okay. That's good.
right?
Actually, I did not know that, and
Yeah.
that was my
Yeah.
question. Yeah. So is IVF very painful and exhausting, or it depends on the clinic you go to?
it see having undergone it, it's not painful. Now, if something is pricking you, of course there'll be that 5 second prick. But whether that prick is going to cause pain for the whole day, no. So it's not painful. I would say discomfort. So that's also another myth because, like, yeah, you answered it on your own that a lot of clinics don't give those tiny needle shots. They'll give those old big needle shots,
Ah,
intramuscular. It's called. So then, of course, it's painful. So
okay.
A, it will depend on the clinic you go to. B, largely 80% of the clinics, it's not painful. It's just minor discomfort, and also the retrieval is done under anesthesia. So there is no cut, there's no bruise, there's no pain, there's no bleed. And it's a daycare procedure. So you do it, you get up, and you go home in the next 3 4 hours. So it's really not painful. Of course, like now, if you go for a dental treatment, also root canal hurts, right? So it's just that kind of a pain wherein little discomfort, but whether it's going to affect your daily lifestyle, not at all. Whether it's going to impact the next years of your life, no. Those things are not there.
Okay. Okay. Yeah, but I think you also make up your mind to an extent that you should be open for few changes when you go for the IVF treatment, right? A
Can you
little bit
define
of
the changes?
like
Like,
it's not going to be perfect. I mean, open to a little bit of discomfort.
Yeah, so
Yes,
see,
a
because
momentary
mm,
discomfort.
Yeah, because see, it's not a smooth thing, and it's not something that is completely difficult to do either. It's in between, like
see, it's something like visiting any doctor. Now,
that's
any
what,
doctor
that's
you
what.
go and they tell you do an MRI, it is
Yeah,
discomfort,
yeah, yeah,
right? So
yeah,
it's
yeah,
something similar,
yeah.
but whether how the media or the people have made it look, no, it's not
Hmm.
like that.
Hmm.
It's not unnatural. It's not extremely painful. We've also heard that some people saying, "Oh, this is the effect of IVF I did 10 years ago." No,
No.
or
Got it.
the injections are very natural, so they don't leave a lasting effect.
I mean, that's very nice. And that thing that you always explain, like I've heard her, overheard her explain to a lot of couples is that, they feel 9 days or 10 days of injections they've got to take. But these are all natural injections that they're taking. And the half life or the time that they're going to be inside your system is very small.
True.
That's why you take it every day. So every day it goes out
You're
of your
right. You're right.
system.
You're right. That's why
So,
you take it every day.
Yeah,
Else you
so
can take everything on one day,
yeah,
correct. Otherwise, it would be so easy first day
Huh.
and then the effect
Yeah, yeah,
lasts.
yeah,
yeah.
yeah.
But the very fact that you have to take it every day tells you that it's not dangerous
Got it.
or
That's a
long
good one.
lasting.
So, about IVF cycles, is it repetitive and, is it a persistence that works? Like being
No,
persistence makes an IVF treatment successful.
Not
no,
really.
no.
No.
Doing instead of persistence, doing it right makes it successful.
Huh.
And right in terms of your, the work that you do on yourself or the work you do in terms of choosing a clinic, choosing the doctor. Those are the things which make it successful. There is no data which points that, okay, 10 IVF cycles will give you a guaranteed success. There can be someone who gets through in the first shot, or there may be someone in the eighth shot. So, persistence, no. Quality matters
Got it.
in
And
term
acting on the right time.
time.
Like you
Yeah.
should
Yeah.
know. That's why information is very important.
Yeah.
And that one assessment that you do after you turn 28, 29 is less than a Friday night meal or probably,
Yeah, yeah.
in so
Starbucks coffee for the
Starbucks.
month.
Yeah.
True, true,
So
So
true, true.
that's why assessment, like an assessment every
It's
year,
just your priorities.
yeah,
Yeah.
it should be a priority.
Thank you, Rishina and Naveen. Y'all have given some solid information about fertility treatments, like choosing the right clinic, choosing the right doctor, and being more informed about what a couple should go through when they're going through an IVF treatment. And I hope this will really add value to people who are taking up treatments.
no, really thank you for having us again on this podcast. And that's the entire objective is our teeny tiny bits of giving back to any person who might need any part of the information from this entire conversation.